Hello ladies, my name is Hannah Poulton and I own HLP therapy clinics in Leicester. I'm a senior physiotherapist, a scar therapist, an acupuncturist and a mummy MOT practitioner, which means I can deliver postnatal assessments for ladies 6 weeks after giving birth. It's C-section Awareness Month in April, so I'm producing these short videos to help ladies recover well after their C-section and advise them on how they can best look after their C-section scar. So in the early days after your C-section, it's always advisable to pat dry your scar when you come out of the shower or the bath. Use a soft cloth, possibly a muslin cloth, making sure that your fingernails are short so they don't catch the scar. And of course you have clean and dry hands yourself, and you're pat drying that scar. You're not rubbing or creating any abrasions over the scar. Especially in those very, very early stages. I'm talking the first week after your C-section. Your scar is in the very immature early phases of scar healing and will need gentle care and looking after it in order for it to close well. You might find that wearing breathable fabrics, such as cottons, are so much gentler against your skin. And make sure that your underwear has no detail or lots of stitching on it that will rub over your C-section scar. Any light breathable fabrics that are not heavily compressed over your scar in the early stages will just help your scar and you recover well. You might find getting in and out of bed a little bit tricky in the early stages as you need to use your abdominals, and these might be quite sore after your C-section. So what I would advise is to roll on your side if you can, keeping your legs together, swing your legs over the bed and then push up into sitting with your arms in a pendulum motion. This pendulum motion can help keep everything together and help you get in and out of bed well. Also, going up and down stairs may be a little bit tricky and uncomfortable, so try and limit the amount of times you go up and down stairs if that's possible. In the early stages, especially that first week, you will need help with somebody passing you the baby so you don't have to lift anything heavy. And be careful as you're bending down. Bend at the knees, and you might want to hold your tummy over your C-section scar as you bend down to give yourself a little bit of support and protection. But try and limit this as much as possible, and of course always ask for help if you can and get people to pass the baby to you or anything else that's heavy that you might need. A C-section is a great operation for keeping you and your baby safe and getting you through a C-section birth. However, it is major surgery, so give yourself plenty of time to rest and recover. I know it's difficult with a newborn. I've got 2 children myself, one of them which was born via a C-section, and I know how difficult it is to rest. But if you can, try and get as much rest as possible after your C-section, as your body will need this to heal and recover. Make sure that you're drinking plenty of fluids, so that's clear water. If you can, 6 to 8 glasses a day to flush your body through, unless you've been explicitly told otherwise by a healthcare practitioner. And really get good nutrition, your healthy fruits, vegetables, grains and oats to really feed you and your C-section scar. In those early stages as well, you might want to be laying on your back when you have 5 minutes to yourself. you can place both hands over your tummy and start to focus on those nice, deep, slow breaths to really start engaging with your tummy and your scar, and to give your body that sense of engagement and relaxation that it will need after such a big operation. If you can, laying on your back, if you have your tummy and it's over your scar, you might want to gently lift your tummy up slightly to let some air get to your scar, especially if it's a really hot day and if you've had your C-section in the height of summer. You might want to gently lay on your back and lift your tummy, just so there is not moisture trapped underneath your tummy and on your scar. As the weeks go by and your scar has healed really well and has closed, after about 4 to 6 weeks, when the scar is fully healed and you've got no infection and you've been checked by your midwife, you can then start doing scar therapy techniques and use a different array of products on your scar, which I'll be talking about in my next video. So hope to see you then. Take care.